Hello, I want to start today with something a little unusual. I want to talk about something that happens to you every single day, multiple times a day, something you probably glance at and then flush away without thinking much about it, your urine. Now, I know this is not the most comfortable topic, but stay with me because your urine is actually one of the most accessible and most informative health signals your body produces every day without any test, without any equipment, without any cost at all. And after the age of 65, the information it carries becomes more important, not less. Because several conditions that become more common with age, including kidney disease, liver problems, urinary tract infections, and diabetes-related complications, all show up in urine changes, often before other symptoms appear. My name is Dr. Daniel Chan. I am a physician in internal medicine, and today I want to walk you through what each urine color actually means, according to what doctors are taught, and what the medical literature actually says, color by color, honestly, with clear guidance on what requires a doctor visit and what does not. Let us begin. Now, before we go color by color, I want to give you one framework that makes everything easier to understand. There is a simple first question that doctors ask when a patient mentions a change in their urine color. And that question is this: did the color change suddenly, or has it been gradual? A sudden change that appeared overnight and that you cannot connect to anything you ate or any new medication deserves more attention than a gradual change that developed slowly over time. The second question is, does it go back to normal within a day or two? Most diet and supplement-related changes and most dehydration-related changes resolve within 24 to 48 hours when you eat differently or drink more water. If a change persists beyond 2 to 3 days, without an obvious explanation, that is a reason to mention it to your doctor. And the third question, is there anything else accompanying it? Pain, burning, urgency, fever, back pain, changes in how often you are urinating. A color change with accompanying symptoms is more concerning than a color change alone. Keep those three questions in mind as we go through each color. Now, let us start with what normal looks like, because you need a baseline. Normal urine is pale yellow to a medium yellow. The yellow color comes from a pigment called urochrome, which is a byproduct of the breakdown of old red blood cells. It is always present in urine, in varying concentrations. The more diluted your urine, the paler the yellow. The more concentrated, the darker. If your urine is a pale straw color, almost clear but with a slight yellow tint, that generally means you are well hydrated and your kidneys are doing their job efficiently. If it is a medium yellow, like a standard lemon color, that is also completely normal and is what most people see for most of the day. The color range from pale straw to medium yellow is what doctors consider the normal range. Now, let us talk about what happens when the color shifts. The first color change I want to discuss is dark yellow to amber. This is the most common change people notice, and in the vast majority of cases, it simply means you are not drinking enough water. When you are dehydrated, your kidneys conserve water. They produce less urine, and the urochrome pigment, which is always there, becomes more concentrated. More pigment per unit of liquid means a darker color. Amber or dark yellow urine, particularly first thing in the morning, is almost always dehydration because your body has gone 7 to 9 hours without fluid. And overnight antidiuretic hormone, a hormone your body releases during sleep, tells your kidneys to conserve water, producing more concentrated and therefore darker urine overnight. So the morning urine being darker is normal and expected. If your urine is dark yellow throughout the entire day, not just in the morning, that is a signal to drink more water. Now, here's something specifically important for adults over 65. Dehydration is significantly more common in older adults than in younger people. And here's why. As we age, our sense of thirst becomes less accurate. Younger people feel thirsty when they need fluid, and that thirst signal is reliable. But after 65, that signal becomes less sensitive. You may genuinely need water and not feel thirsty at all. This means that by the time an older adult notices they are thirsty, they may already be meaningfully dehydrated. This is why doctors recommend that adults over 65 drink fluids consistently throughout the day, rather than waiting for thirst to prompt them. If your urine is consistently dark yellow, more days than not, that is a practical signal that your fluid intake may need to increase. Talk to your doctor about how much fluid is appropriate for you specifically, because people with certain heart or kidney conditions may need to manage fluid intake carefully, and the general guidance may not apply directly to your situation. Dark yellow urine can also be caused by vitamin B supplements, particularly high-dose B2 or riboflavin, and by certain B vitamin complexes. These can make urine appear bright or dark yellow, or even orange yellow, which can be alarming if you do not know it is from your vitamins. If you recently started a B vitamin supplement and noticed a change in urine color, that is almost certainly the explanation. It is harmless. Now, the second color I want to discuss is orange. Orange urine is less common than dark yellow, and it has a wider range of possible causes. The most common cause, in seniors specifically, is certain medications. A medication called phenazopyridine, which is commonly prescribed for short-term relief of urinary tract infection symptoms, turns urine a bright orange to orange-red color. This is expected, known, and harmless. It is listed on the medication label. Other medications that can cause orange urine include rifampicin, an antibiotic used for tuberculosis and some other infections, sulfasalazine, used for inflammatory bowel disease and rheumatoid arthritis, and certain laxatives. If you are on any of these medications, orange urine is an expected side effect, not a cause for concern. Dietary causes of orange urine include eating large amounts of carrots or foods high in beta-carotene, and high-dose vitamin C supplements. Now, here is the important point about orange urine. If orange urine occurs alongside pale stools or yellow tinting of the skin or eyes, what doctors call jaundice, that combination is a warning sign for a bile duct or liver problem and deserves prompt medical evaluation. Orange urine with pale stools means that bile is not flowing properly, and instead of going into the digestive system as it should, it is backing up into the bloodstream and being filtered out through the kidneys into the urine. This is not a wait-and-see situation. If you see that combination, please contact your doctor promptly. Now, the third color is pink or red, and this one understandably concerns people the most. So I want to be specific and calm about it. Pink or red urine has two broad categories of causes. The first category is benign dietary causes. The most common, eating beetroot or beets, can turn urine pink to red, sometimes dramatically so. If you have eaten beets in the last 24 hours and your urine has turned pink or red, that is almost certainly the explanation. It is called beeturia. It is harmless, and it resolves within a day. Blackberries and rhubarb can also cause pink or red urine, as can certain food dyes. Some medications cause red or pink urine as well, including rifampicin and senna-containing laxatives. The second category of causes is blood in the urine. This is called hematuria, and it is something that always deserves medical evaluation, particularly in adults over 65. Now, there are two types of hematuria. The first is gross hematuria, which means blood visible to the naked eye, making urine appear pink, red, or smoky brown. The second is microscopic hematuria, where the blood is not visible but is detected on a urine dipstick test or under a microscope. In adults over 65, painless gross hematuria, meaning you see blood in your urine but you have no pain deserves prompt evaluation. Not tomorrow, not next week, soon. Because in older adults, painless hematuria can occasionally be an early sign of bladder cancer, kidney cancer, or other conditions that are far more manageable when caught early. Now, I want to be clear. The vast majority of hematuria cases in older adults are caused by much less serious things: urinary tract infections, kidney stones, benign prostatic hyperplasia in men. Certain medications, including blood thinners and vigorous exercise, can all cause hematuria. But because the differential diagnosis, the list of possible causes, includes conditions that need early detection, all visible blood in urine in an adult over 65 should be evaluated. Please do not assume it is just a UTI and wait to see if it clears. Mention it to your doctor. Let them evaluate it properly. The fourth color is brown or tea-colored. Dark brown urine that looks like tea or cola is something that needs attention, particularly if it does not clear up with hydration within 24 hours. The causes of brown urine fall into several categories. The first is severe dehydration, where the urine becomes so concentrated that it appears brown rather than yellow. Drinking more water and watching for improvement over a day is reasonable if you have been ill, have had diarrhea or vomiting, or have been outdoors in the heat, and have not been drinking enough. But if the brown color persists after increasing fluid intake, do not continue to wait. The second cause is liver disease. Brown or tea-colored urine is a recognized sign of liver problems, including hepatitis and cirrhosis. When the liver is not processing bilirubin properly, bilirubin accumulates in the blood and is filtered into the urine by the kidneys, where it turns it a dark brown or orange-brown color. This is often accompanied by pale or clay-colored stools, because the bilirubin that should be going into the digestive system is going elsewhere. And by yellowing of the skin and eyes. If you notice brown urine, pale stools, and any yellowing of your skin or the whites of your eyes, please seek medical evaluation that day, not in a week, that day. The third cause of brown urine that I want to mention specifically is a condition called rhabdomyolysis. This is the breakdown of muscle tissue that releases a protein called myoglobin into the bloodstream, where it is filtered by the kidneys and turns the urine brown or cola-colored. Rhabdomyolysis can be caused by severe muscle injury, extreme exercise, certain medications, including high-dose statins in rare cases, or severe illness. The urine in rhabdomyolysis is often described as the color of cola or dark tea, and it is typically accompanied by muscle pain and weakness. This is a medical emergency if you have muscle pain, weakness, and very dark brown urine after significant exertion or after a fall or injury. Please go to the emergency room. Rhabdomyolysis can damage the kidneys and requires prompt treatment now. The fifth color is cloudy or milky urine. Urine should generally be clear, not opaque. Cloudy urine has several possible causes. The most common in older adults is a urinary tract infection, bacteria in the urine, along with white blood cells responding to the infection, create a cloudy or murky appearance. UTs in older adults are worth discussing specifically because they often present differently than in younger people. In younger adults, a UTI typically causes burning, urgency, and frequency. Classic symptoms that make the diagnosis straightforward. But in older adults, particularly those over 75, UTs can sometimes present without the typical burning and urgency. Instead, an older adult may experience sudden confusion or worsening of existing cognitive symptoms, increased falls, or general malaise, without the classic urinary symptoms. This is called an atypical UTI presentation, and it is one reason why UTIs are sometimes missed or delayed in diagnosis. In older adults, if a senior develops sudden confusion or a sudden decline in function without an obvious explanation, a UTI is one of the first things a doctor should check for. Other causes of cloudy urine include kidney stones, which can cause crystals to appear in the urine, phosphate crystals, which are harmless and can appear in urine after eating certain foods, and in some cases, more serious kidney conditions. A cause of cloudy urine that deserves specific mention is foamy or frothy urine. If your urine has persistent foam or froth that does not go away after a minute or two, that can be a sign of protein in the urine called proteinuria. Now, a small stream can create temporary foam from the force of the flow that is not the same thing. The foam I am talking about is foam that persists, stays in the toilet bowl for a minute or more after urination. Protein in the urine is a recognized sign of kidney damage and is something that doctors monitor specifically in people with diabetes and high blood pressure, both of which are risk factors for kidney disease. Because the kidneys filter the blood, when they are damaged, they allow protein to leak through into the urine, which should not be there. If you notice persistent foamy urine, particularly if you have diabetes or high blood pressure, please mention it to your doctor. They can check for protein in the urine with a simple urine dipstick test, which is quick, inexpensive, and very informative. Now, I want to spend a moment on two unusual colors that are worth knowing about, even though they are much less common. The first is green or blue urine. This is rare, and in most cases, it is caused by a medication. Amitriptyline, an older antidepressant, can cause blue-green urine. Propofol, a medication used for anesthesia, has been associated with green urine in rare cases. And certain artificial food dyes can occasionally cause green or blue tinting, very rarely. Green urine can indicate a bacterial infection with a specific organism called Pseudomonas, which produces a green pigment. If you have green or blue urine and you are not on any medication known to cause it, please mention it to your doctor. The second unusual color is very pale or colorless urine, almost like water, with no yellow at all. In most cases, very pale or clear urine simply means you are very well hydrated or you have been drinking a lot of fluid, which on its own is not a concern. But if you are producing very large volumes of very pale urine consistently without drinking unusually large amounts of fluid, that pattern can sometimes indicate a condition called diabetes insipidus, which is unrelated to diabetes mellitus and involves a problem with the hormone that regulates water balance. Or it can be a sign of uncontrolled diabetes mellitus, where high blood sugar causes the kidneys to produce large volumes of dilute urine. If you notice yourself urinating very frequently in large amounts, and the urine is consistently very pale or colorless without drinking excessive amounts of fluid, that is worth mentioning to your doctor. Now, I want to address something specific to medications because many adults over 65 are on multiple medications, and several commonly prescribed drugs can change urine color in ways that are not harmful but can be alarming if you do not know about it. I have already mentioned some, but let me give you a more complete picture. Metronidazole, an antibiotic sometimes prescribed for certain infections, can cause dark brown urine. Quinine, used for leg cramps, can also cause brown urine. Nitrofurantoin, used for urinary tract infections, can cause brown or dark yellow urine. Chloroquine and hydroxychloroquine, used for malaria and rheumatic conditions, can cause dark urine. And warfarin, a blood-thinning medication, does not typically change urine color itself, but if it causes bleeding in the urinary tract, the urine may turn pink or red, which in that context is a reason to contact your doctor promptly. The general principle is this: if you start a new medication and notice a change in your urine color within a few days, check the medication information leaflet first. Color changes are often listed as known side effects, and in many cases, they are harmless and expected. If the color change is not listed, or if you are unsure, call your pharmacist. Pharmacists are an excellent and underused resource for exactly this kind of question. Now, I want to bring everything together into a clear, practical guide that you can refer back to. Pale straw to medium yellow, normal. This is what you want to see most of the time. Dark yellow to amber, usually dehydration. Drink more water through the day. If it persists after improving hydration, or if it is accompanied by other symptoms, mention it to your doctor. Orange. Check your medications and supplements first. If you are on phenazopyridine or a B vitamin complex, that is the likely explanation. If orange urine is accompanied by pale stools and yellow skin, seek medical evaluation promptly. Pink or red. Think about what you ate in the last 24 hours. Beets, blackberries, rhubarb. If no dietary explanation, please see your doctor. Do not assume it will go away, particularly if there is no pain, because painless blood in the urine in older adults always deserves evaluation. Brown or tea-colored. If it clears with hydration within 24 hours after a period of dehydration, it may be nothing more than that. But if it persists, or if it is accompanied by pale stools, yellow skin, or muscle pain after injury or exercise, seek medical evaluation promptly. Cloudy or milky. Consider whether you might have a UTI, particularly if accompanied by burning. Urgency, or any change in mental clarity. Mention it to your doctor. Foamy or frothy with persistence. Mention this to your doctor specifically, and ask whether a urine protein test makes sense, particularly if you have diabetes or high blood pressure. Green or blue. Check your medications. If no medication explanation, mention it to your doctor. Very pale or colorless in large volumes. Mention it to your doctor if it is a consistent pattern, without unusually high fluid intake. Now, I want to close with something important about when to see a doctor versus when to watch and wait. The general rule I give my patients is this. If a color change returns to normal within 24 to 48 hours and you can connect it to something you ate or a supplement or medication you take, it is usually safe to watch and wait. If a color change persists beyond 48 hours without an obvious dietary or medication explanation, mention it to your doctor. If a color change is accompanied by pain, burning, fever, back pain, or any feeling that something is wrong, do not wait. Contact your doctor or seek care promptly. And if you see blood in your urine, visible pink or red coloration, without a clear dietary explanation, please contact your doctor. In older adults, the threshold for evaluation should be lower, not higher, than in younger people, because the conditions worth catching early are more common in this age group, and because earlier evaluation leads to better outcomes. Your urine is not a perfect diagnostic tool. Color alone does not tell the whole story, but it is a free, daily, accessible signal that deserves a moment of attention, rather than simply being flushed away. I am Dr. Daniel Chan. Thank you for spending this time with me today. If this gave you something useful, a clearer picture of what to watch for and when to act, please share this video with someone you care about who deserves this information. Leave your questions in the comments. I read every single one, and I will see you in the next video. Take care of yourself.